Did you know that colon cancer, also known as colorectal cancer, often develops silently or lurking in the shadows without any noticeable symptoms? This makes early detection incredibly challenging, and that's why awareness is so crucial. It originates in the colon or rectum, typically starting as non-cancerous polyps that can gradually evolve into cancerous growths. In fact, colon cancer is the third most common cancer in the United States, with a lifetime risk of about 4%. That means 1 in every 25 people may face this diagnosis at some point in their lives. But here's the catch. The early stages of colon cancer often present no symptoms at all. This is why it's vital to stay informed and vigilant about your health. Have you ever experienced any unusual changes in your body that you brushed off as nothing? What if those changes were your body's way of signaling something more serious? In today's video, we're going to uncover 10 silent symptoms of colon cancer that you might be ignoring. The number 2 and 3 are the most dangerous. By the end, you'll have the knowledge you need to take charge of your health and potentially save your life. Before we dive into these questions and explore these critical signs, if you're new to our channel, let's grow together. Don't hesitate to like this video and subscribe so you won't miss our upcoming content. Your journey to better health starts here, and we're excited to be part of it. Number 10, blood in stool. One of the most alarming symptoms of colon cancer is blood in your stool. This can manifest in various ways, from bright red streaks to dark tar-like stools. If you notice bright red blood, it often indicates bleeding in the lower gastrointestinal tract, which could be a sign of a polyp or other issues in the colon or rectum. On the other hand, dark stools may suggest that the bleeding is occurring higher up in the digestive tract, such as in the stomach or small intestine. It's important to pay attention to any blood you might see, whether it's in the toilet bowl or on toilet paper after wiping. Even if it seems minor, such as a few streaks, it's a signal that something isn't right and deserves your attention. Sometimes blood may not be visible at all and can only be detected through testing, which is why regular checkups are essential. While blood in the stool can be caused by various conditions, including hemorrhoids or anal fissures, it's crucial to take this symptom seriously. Ignoring it could lead to more significant health issues down the line. So keep an eye on your body and be aware of any changes. It could make all the difference in your health journey. Number 9, persistent abdominal discomfort. Another significant symptom to watch for is persistent abdominal discomfort. If you find yourself experiencing ongoing pain or cramping in your abdomen, especially if it's increasing in frequency or severity, it's essential to take note. This discomfort can manifest as a dull ache or sharp pain, and it may be accompanied by bloating or tenderness in the abdominal area. While occasional stomach discomfort is common and often linked to dietary choices or stress, persistent pain can indicate underlying gastrointestinal issues, including colon cancer. It's your body's way of signaling that something may be wrong. Bloating in particular can be a sign of various digestive problems, but when combined with other symptoms, it could point to more serious conditions. If you're experiencing this type of discomfort regularly, it's worth paying attention to any patterns or changes. Are there specific foods that trigger the pain? Does it occur after meals or at certain times of the day? Keeping track of these details can provide valuable insights into your health. Remember, your body communicates in various ways, and persistent abdominal discomfort is one of those signals that should not be ignored. Number 8, significant weight changes. Have you experienced significant weight changes recently? This is a symptom that can often go unnoticed, but both unexplained weight loss and unexpected weight gain can be concerning indicators of underlying health issues, including colon cancer. Take the story of Sarah, a vibrant 25-year-old who loved her active lifestyle. One day, she noticed that her clothes were fitting differently. She had lost a noticeable amount of weight without changing her diet or exercise routine. At first, she brushed it off as a result of her busy schedule, but as the weeks went by, the weight continued to drop. Worried, Sarah decided to visit her doctor, who reassured her that it was likely nothing serious and attributed it to stress. However, Sarah couldn't shake the feeling that something was off. Trusting her instincts, she insisted on further testing, including a colonoscopy. To her shock, the results revealed the presence of a tumor in her colon. Sarah's story is a powerful reminder that significant weight changes should never be ignored. Whether it's losing weight unexpectedly or gaining it without explanation. These fluctuations can signal that your body is dealing with something more serious. Your body communicates in various ways, and when it comes to weight changes, it's crucial to listen closely and seek answers. After all, being proactive about your health can make all the difference. Number 7, changes in bowel habits. Changes in bowel habits can be one of the most telling signs of potential health issues, including colon cancer. If you find yourself experiencing persistent diarrhea or constipation lasting more than a few days, it's essential to pay attention. While occasional fluctuations in bowel movements are normal, ongoing changes can indicate that something is amiss in your digestive system. One specific change to watch for is the appearance of thin, pencil-like stools. This can be a significant warning sign, as it may suggest that the colon is narrowing due to a tumor. When the passage through the colon is obstructed, it can alter the shape of your stools, making them appear thinner than usual. Additionally, many people experience a sensation of incomplete evacuation after bowel movements. This feeling can be frustrating and uncomfortable, and it may indicate an obstructive lesion in the colon. If you frequently feel like you haven't fully emptied your bowels, it's a signal that you should take seriously. Being aware of these changes is crucial for your health. Your body is trying to communicate with you, and understanding these signs can lead to early detection and better outcomes. If you notice any of these symptoms, don't hesitate to seek medical advice. Remember, your digestive health is an essential part of your overall well-being. Number 6, narrowing of stools. Have you noticed your stools becoming thinner or more ribbon-like? This change can be more than just a minor inconvenience. It could indicate a blockage in the colon, which is a significant red flag for potential health issues, including colon cancer. When the colon is obstructed, it can alter the shape of your stools, making them appear thinner than usual. Medical studies have shown that changes in stool shape can be associated with colorectal tumors. For instance, research published in the American Journal of Gastroenterology highlights that patients with colon cancer often report changes in their bowel habits, including the appearance of narrow stools. This occurs because a tumor can create a physical obstruction, preventing normal stool formation and passage. It's important to understand that while narrow stools can be caused by various factors, such as dietary changes or gastrointestinal conditions, persistent changes should not be ignored. If you notice this symptom alongside others, like abdominal pain or changes in bowel habits, it's crucial to take action. Being proactive about your health means paying attention to these signs. If you find your stools are consistently thin or ribbon-like, consider discussing this with your healthcare provider. Early detection can lead to better outcomes, so don't hesitate to seek the answers you need for your well-being. Number 5, chronic fatigue. Feeling unusually tired? If you find that chronic fatigue is weighing you down and doesn't improve with rest, it's essential to pay attention. Chronic fatigue can be more than just a result of a busy lifestyle or lack of sleep. It can be a symptom of something more serious, including colon cancer. Research has shown that fatigue is a common complaint among individuals diagnosed with colorectal cancer. A study published in the Journal of Clinical Oncology found that nearly 40% of patients reported significant fatigue as one of their primary symptoms, often linked to the body's response to cancer and its treatment. This fatigue can stem from various factors, including anemia, which is common in those with colon cancer due to chronic blood loss. Moreover, the body's energy levels can be severely impacted when it is fighting off disease. If your fatigue is persistent and accompanied by other symptoms such as changes in bowel habits, unexplained weight loss, or abdominal discomfort, it's crucial to take these signs seriously. Chronic fatigue can affect your daily life, making it difficult to concentrate or engage in activities you once enjoyed. If you're experiencing this type of fatigue, don't hesitate to reach out to your healthcare provider. Understanding the root cause of your fatigue is vital for your overall health and well-being. Remember, your body is trying to tell you something, and it's important to listen. Number 4, anemia symptoms. Are you feeling weak or fatigued? If so, you might be experiencing symptoms of anemia, which is often linked to chronic blood loss and can lead to significant health concerns. Anemia occurs when your body doesn't have enough healthy red blood cells to carry adequate oxygen to your tissues, resulting in feelings of fatigue, weakness, shortness of breath, and even pale skin. In the context of colon cancer, anemia can be particularly concerning. Research published in the American Journal of Gastroenterology indicates that many patients with colorectal cancer experience chronic gastrointestinal bleeding, which can lead to iron deficiency anemia. This type of anemia develops when the body loses more blood than it can replace, often due to bleeding from tumors in the colon. The symptoms of anemia can be subtle at first, but they can progressively worsen, impacting your daily life. You might find yourself feeling unusually tired after simple activities or struggling to catch your breath during mild exertion. It's important to recognize these signs as they can indicate that your body is not getting the oxygen it needs to function properly. Understanding the connection between anemia and colon cancer is crucial. If you notice these symptoms, it's essential to investigate further, as addressing anemia can significantly improve your quality of life and overall health. Number 3, unexplained nausea or vomiting. Have you been experiencing persistent nausea or vomiting? While these symptoms are often associated with common illnesses or dietary indiscretions, they can also be indicative of more serious health issues, including colon cancer. Many patients who have faced a diagnosis of colorectal cancer report experiencing unexplained nausea as one of their early symptoms. This nausea can be particularly concerning when it is accompanied by vomiting, especially if it seems to occur without any clear cause. In some cases, these symptoms may arise due to a bowel obstruction caused by a tumor. When a tumor grows large enough, it can block the normal passage of food and waste through the intestines, leading to feelings of nausea and the urge to vomit. A study published in the Journal of Gastroenterology highlights that patients with bowel obstructions often experience significant discomfort, including nausea, which can severely impact their quality of life. For many, this symptom can be frustrating and confusing, as it may not seem directly related to their digestive health. Understanding the potential link between unexplained nausea and colon cancer is crucial. If you find yourself dealing with persistent nausea or vomiting, it's important to consider the broader context of your health and any accompanying symptoms. Recognizing these signs early can lead to timely intervention and better outcomes. Number 2, feeling of incomplete bowel movements. Do you often feel like you need to go to the bathroom? Even after you've just been, this sensation of incomplete bowel movements can be both uncomfortable and concerning. It's not just a minor annoyance. It can indicate an underlying issue with your colon. Many people experience this feeling at some point, but when it becomes persistent, it's essential to pay attention to what your body is trying to tell you. This sensation can be linked to several factors, including constipation, hemorrhoids, or even more serious conditions like colon cancer. When a tumor develops in the colon, it can create a blockage or narrowing that prevents normal bowel movements. As a result, you may feel an ongoing urge to go, even if your bowels are empty. This can be particularly frustrating, as it may lead to straining or discomfort during bathroom visits. Additionally, this feeling can relate closely to changes in bowel habits, such as diarrhea or constipation. If you're experiencing a combination of these symptoms, it's crucial to take note. Research has shown that patients with colorectal issues often report a sensation of incomplete evacuation, which can significantly impact their daily lives. Understanding this symptom in the context of your overall digestive health is vital, as it can lead to important insights about your well-being. Number 1, changes in appetite. Lastly, have you noticed sudden changes in your appetite? This can be a subtle yet significant sign that something isn't quite right in your body. Many people experience fluctuations in their appetite from time to time, often due to stress, lifestyle changes, or dietary habits. However, when these changes are abrupt and persistent, they can indicate underlying health issues, including colon cancer. For instance, some individuals may find themselves feeling unusually full after eating only a small amount of food, while others might lose interest in food altogether. This loss of appetite can be particularly concerning, as it may lead to unintended weight loss and nutritional deficiencies over time. Research has shown that changes in appetite are common among patients with colorectal cancer, often linked to the body's response to the disease and its effects on digestion. Understanding the connection between appetite changes and your overall health is crucial. If you're experiencing a sudden decrease in appetite or a feeling of fullness that doesn't seem normal, it's important to consider the broader context of your health. This symptom can be easily overlooked, but recognizing it as a potential warning sign can lead to timely intervention and better health outcomes. Listening to your body and being aware of these changes is an essential part of maintaining your well-being. Understanding symptoms. Now that we've covered the various symptoms associated with colon cancer, it's crucial to understand their significance. While signs such as blood in stool, persistent abdominal discomfort, changes in bowel habits, and appetite fluctuations can indicate colon cancer, they may also stem from other conditions, such as gastrointestinal infections, irritable bowel syndrome, or even stress-related issues. This overlap can make diagnosis challenging. Therefore, if you notice any of these symptoms persisting or worsening, it's essential to consult a healthcare professional. Early evaluation can lead to timely diagnosis and treatment, ensuring better health outcomes. Your awareness is the first step toward proactive health management. How is colorectal cancer detected? How is colorectal cancer detected? Regular screenings play a vital role in early detection and prevention. The American Cancer Society recommends that individuals begin screenings at age 45, as this is when the risk of developing colon cancer increases. However, if you have specific risk factors, such as a family history of colorectal cancer or certain genetic conditions, you may need to start screening even earlier. Common screening methods include colonoscopies, which allow doctors to examine the colon for polyps or abnormalities, and stool tests, which can detect hidden blood or other signs of cancer. Early detection is key to successful treatment. What are the risk factors for colon cancer? Let's discuss the risk factors associated with colon cancer. Several factors can increase your likelihood of developing this disease. Age is a significant factor as the risk rises after age 45. A family history of colorectal cancer or certain genetic conditions, such as Lynch syndrome, can also elevate your risk. Additionally, lifestyle choices play a crucial role. A diet high in red or processed meats, physical inactivity, and obesity are linked to a greater risk. Furthermore, smoking and heavy alcohol use have been associated with an increased likelihood of colon cancer. Understanding these risk factors can help you make informed health choices. How to prevent colon cancer? Prevention is key when it comes to reducing your risk of colon cancer. Maintaining a healthy lifestyle is essential. Start by adopting a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, which can provide the nutrients your body needs to function optimally. Regular exercise is equally important. Aim for at least 150 minutes of moderate activity each week to help maintain a healthy weight and improve overall health. Additionally, avoiding tobacco and limiting alcohol consumption can significantly lower your risk. By making these positive lifestyle choices, you can take proactive steps toward protecting your health and reducing your chances of developing colon cancer. To recap, being aware of these silent symptoms and understanding the importance of screenings can make a huge difference in your health. Recognizing signs like changes in bowel habits, unexplained fatigue, and appetite fluctuations is crucial for early detection. If you found this information helpful, please share it with friends and family. Let's spread awareness and keep each other healthy. Thank you for watching. If you enjoyed this video, don't forget to like, subscribe, and hit the notification bell for more health tips. Remember, staying informed is the first step toward a healthier life. See you in the next video, and click on one of the videos on your screen to keep learning.